We're not serving a population that even has any priority at all. Honestly, I was the nurse. I was the nurse practitioner that you give me a baby that's going to cry for 12 hours. This is not a good day. I don't want to take care of this baby that's going to cry, and I also don't want to care for parents that are homeless that did this to their baby. I
Mhm.
did not understand opiate use disorder or substance use disorder. I didn't understand mental health. When you go to school to be a doctor, unless you're going in behavioral health or a nurse, you learn medical. You don't learn behavioral health. If we need behavioral health help, we do a consult to, a professional to do that.
Right.
I don't take care of that. And my eyes were just really open because 24 babies at any given time, just in our East Valley, we are totally not serving them correctly. And I ended up finding out that, gosh, if it's quiet in our nurseries, so say we didn't have six babies, say we only had two, and we had enough staff at certain parts of the day with certain nurses or certain doctors, the babies did better.
Mm.
And it was like, okay, how come they're doing better when Deb is on, but when Georgina's on, they're not good? Why is that? And yes, babies have, different times of the day where they're having a more difficult time, but there was a pattern. And you really were like, boy, okay, if Deb's on, they do great. You never need to give them, extra morphine, you usually can wean. But then at night you would find between 2 and 5 a.m. I had a dad, 3 sets of parents tell me about the last dad who was an adoptive dad that we had taken care of his previous baby, probably about 18 months prior. All of them told me at several occasions that they were not going to leave their baby that next night. And I was like, what do you no, we don't have a place for you to stay. Why don't you feel comfortable with us?